We have had a huge influx in the last 2 to 3 days of children with classic symptoms: fever, cough, runny nose, sore throat, body aches. And the population is a little bit different than we typically see in the clinic this time of the year. Normally this time of the year we see younger kids with colds and ear infections, maybe school-age children every once in a while with like a sore throat or strep throat, but the sheer numbers of elementary school, middle school children that we've had coming in is much higher than it traditionally is, and so we can tell that we're seeing lots of H1N1 in the clinic.
And this is different even than a week ago?
Absolutely, absolutely. I think a lot of it has to do with the change in the weather. It's suddenly gotten much colder, and we tend to see these types of viruses come out more when it's colder. Yeah, we're definitely seeing a lot more of it. Just in the last, it's been striking the last 2 days for sure. We've seen a lot more patients with it.
And are these the patients that you would want to see in the clinic, as opposed to what we've been telling people, if it's not severe, just tough it out at home?
For the most part, I think so, yes. The general wisdom is treat the patients, treat your child, treat their symptoms, make sure they're drinking lots of fluids, treat their fevers if they're uncomfortable with Tylenol or Motrin, acetaminophen, ibuprofen type products, and watch for worsening of symptoms. Breathing faster, breathing heavier, skin that looks mottled or pale, a child that has a severe headache or a severe neck ache, or a child that seems overly confused or sleepy. Those are the kinds of things that we want to see in the clinic, as well as if you have a child who, yeah, I think my child had H1N1, they seem to be getting better, but now they're getting significantly worse. Those are the kind of patients that we want to see in the clinic, and those are the kind of patients that so far we've been seeing. We've gotten a lot of phone calls from worried parents, and we're more than happy to help address those concerns and allay those concerns. But for the most part, the clinic's a sick place to be. There are a lot of germs here, so if people can stay away unless absolutely necessary, that's the best thing.